Right now on 12 News at 10, the flu epidemic is absolutely surging in Arizona.
The outbreak is nearly as bad as the 2009 to 2010 season when we saw a global outbreak. The State Department of Health confirming nearly 1,500 more cases from January 21st to January 27th, bringing the total number of cases this season to a little more than 19,000. Now, Tamiflu can help, but the medicine can have side effects like seizures, hallucinations, and itchy skin.
But tonight, some parents and pediatricians are paranoid about prescribing it or giving it to their kids. Team 12's Rachel Cole joins us with why some parents think the antiviral drug is a potentially fatal prescription.
As if the flu itself wasn't enough to worry about, now this. The flu is widespread across the country, and we're told it hasn't even peaked yet. And now a new concern with these reports of bizarre side effects.
16-year-old Charlie Harp was your typical high school teen, loved football and his family, and says he was loved by everyone he met. His family now devastated, though, days after he took his own life. They say he never expressed suicidal thoughts. The only thing that changed was he started taking Tamiflu the day before.
So I started researching it, where children had been delusional, having, hallucinations. They just weren't in their right mind.
The family believes the medicine is the reason Charlie committed suicide, but there's no way of knowing for sure. The warning label, though, does state pediatric patients may be at increased risk of confusion and abnormal behavior.
If it's that big of an issue, why are we still prescribing it and giving it to our children?
The makers of Tamiflu tell 12 News, quote, "We cannot comment on the specific case you mentioned at this time, but added neuropsychiatric events have been reported during administration of Tamiflu in patients with influenza, especially in children and adolescents." These flu med fears have parents in limbo about what to do when their child gets sick.
I've never been panicked like that in my life.
But doctors say the panic may not be necessary.
They've read stuff on social media that don't give your child Tamiflu because there are risk of, and very rare risk of, seizures, confusion, and perhaps even more complicated neurologic symptoms. But those are exceedingly rare.
Pharmacists say despite growing concerns about dangerous side effects, the need for the medicine is vital.
Probably one of the highest demand years I've ever seen.
Tamiflu is recommended within 48 hours of showing symptoms. The most common side effects are nausea, vomiting, and headaches. In the newsroom, Rachel Cole, 12 News.